likely to experience increased sensitivity and pain as erosion occurs and continues to occur. Therefore, dentists try to limit erosion past the enamel and into the dentin layer, as this would increase the chances of decay and therefore increase the rate of decay caused by the buildup of bacteria from food that is stuck within the mouth. Thank you.
Okay, so who is affected the most by dental erosion? Erosion is generally considered to be the most prevalent cause of tooth wear in the UK and Europe, and it's highly prevalent amongst teenagers and young adults. More than 30% of 14-year-olds show evidence of erosion on the palatal or the inner surfaces of the upper incisors. This is due to the consumption of acidic drinks and foods, such as energy or fizzy drinks or acidic fruits. In addition to this, people who suffer from eating disorders have a lot of dental erosion. This is because of frequent vomiting, which exposes the teeth to stomach acid and affects the lingual surfaces, which is the back of the upper front teeth. In addition to this, people with gastroesophageal reflux, they regurgitate a lot of hydrochloric acid from the stomach, and obviously stomach acid has a very low pH between 1.5 to 2 and can cause severe erosion of the tooth enamel. And lastly, people with xerostomia or dry mouth. It's a condition in which there is a significant reduction in the flow of saliva in the mouth, and saliva plays a huge role. It's an alkaline in pH, and it counteracts the acid attacks of bacteria and helps increase buffering, and it helps maintain a neutral pH inside the mouth. So when someone doesn't have an adequate amount of saliva, the resulting dry mouth has an acidic pH. And studies show that enamel begins to demineralize or soften at a pH of 5.5. So all in all, a low pH causes demineralization, and which results to enamel erosion and decay. Thank you.
So I will be talking about the causes of dental erosion. One of the main causes is diet. This is because when you eat or drink something other than water, the pH in your mouth drops due to exposure to extrinsic acids. For example, highly acidic beverages such as carbonated fizzy drinks, alcoholic drinks, juices, and sports drinks have a pH ranging from 2.1 to 4, which is highly acidic and proven to make teeth more prone to erosion by softening the enamel surface. Acidic food items also have the same effect, and some examples include citrus fruits, so lemons, oranges, limes, vinegars, and tomatoes. Next, another big factor is stomach acid. The stomach contains many strong acids used to digest food. However, this leads to intrinsic dental erosion, as there is repeated gastric acid exposure through causes such as acid reflux, eating disorders like bulimia, which exposes surfaces of the teeth to gastric acid and vomit, leading to severe damage and dental erosion, chronic vomiting associated with pregnancy, and chronic alcoholism. Some lifestyle choices can lead to dental erosion. For example, those who frequently consume alcohol, such as wine tasters, are more at risk as many alcoholic drinks are acidic or sugary, as previously stated. Those taking specific medications such as antihistamines, decongestants, painkillers, and antidepressants that reduce saliva flow will experience a lack of saliva, which increases the risk of dental decay and dental erosion. This is because saliva has antibacterial properties and can neutralize acids. Activities like competitive swimming exposes the teeth to chlorine and pool water, also leading to dental erosion. And lastly, environmental factors such as an acidic diet, masculine gender, and lower socioeconomic status were associated with higher prevalence and severity of dental erosion in an examined population. European countries clearly show that the problem applies to all age groups. However, there is a particular increase in the frequency of dental erosion observed among adolescents and young adults, as most adolescents were found to have highly unsatisfactory low health awareness and acidic diets. Thank you.
So what are the signs and symptoms of dental erosion? Individuals that present with dental erosion in the dentist usually present with several symptoms, and some of the key ones have been listed below. So the first one would be erosion lesions, which is more commonly known as cupping, and these are indentations on the biting surfaces of the teeth, usually on the molars, as you can see in the image here. Um, and the second most common one would be discoloration, and that's when the partially translucent layer of the enamel erodes, which would cause the softer, more yellow dentin layer to become exposed. And you can also see that in the picture here, in the circled parts where that softer dentin layer below is starting to become a lot more visible. The third one would be sensitivity, and this is one of the earliest signs of dental erosion. And patients usually present to the dentist saying that they have some pain whenever they eat sweets or whenever they have hot or cold food. Uh, and that's one of the signs of dental erosion. The fourth would be smooth or shiny surfaces, and that begins to appear because of demineralization of the enamel. And you can also see that in the picture here, where most of the molars on the left-hand side with the patient that has dental erosion, they're quite smooth and shiny, whereas the picture on the right, with the healthy patient's molars, you can see that it's a lot more rough and light isn't really reflecting as much. Yeah, thank you.
So how is dental erosion assessed? It can be assessed in various ways, some of which include clinical examination, measurement of mineral loss such as calcium and phosphorus content, change in the quality and quantity of the hard tissue surface, and visual examination, which includes looking for characteristics such as smooth, silky glazed, or sometimes dull enamel surface, the loss of surface texture or thinning of the enamel, and a yellow appearance. Erosion can also be identified via tactile examination, which is where probe is used, in which you check for softened enamel or dentine. However, the main way of assessing dental erosion is the BEWE scale, which stands for the Basic Erosive Wear Examination. This indicates the severity of the erosion. BEWE scores each sextant, which is one of the 6 sections of the mouth. So 0 indicates no erosion, so the tooth is healthy. 1 indicates initial loss of surface texture, which means the tooth is starting to erode, as you can see in the picture on the right. 2 is distinct defect, which is less than 50% of the surface area of the tooth has eroded. And 3 is hard tissue loss, which is more than or equal to 50% of the surface area of the tooth has eroded. The highest scores per sextant are then added up to help determine the severity of the erosion and how to proceed going forward.
So, how is dental erosion prevented and managed? So, one of the most important steps in preventing dental erosion is to reduce acid exposure because acids in our diet, like those found in fizzy drinks and fruits, they lower the pH in our mouth, which leads to enamel demineralization. And the enamel, once lost, cannot be regenerated naturally, so it's really important to be proactive here. Some strategies include limiting how often we consume acidic foods and drinks, especially between meals, because frequent acid attacks don't give enamel enough time to recover. Also, using a straw can help direct the liquid away from teeth, and drinking water right afterwards can dilute and wash away the acids. Even something as simple as eating cheese or milk after an acidic meal can help because they're classified as dairy products and they're rich in calcium and they help to neutralize the acids. Avoid brushing immediately after acid contact. So a lot of people are surprised to learn that brushing immediately after having something acidic can actually cause more harm than good. But this is because after the initial exposure to the acid, the enamel surface becomes temporarily softened and more vulnerable to mechanical damage. And if you brush during this softened period, you can actually wear away the weakened enamel layer. So instead, it's best to wait about 30 minutes to an hour before brushing your teeth because this gives saliva enough time to buffer the acids and begin the remineralization process. In the meantime, rinsing with water or a fluoride mouthwash can help protect the enamel until it's safe to brush. The third point is to manage a dry mouth. This is also known as xerostomia, and it's another important preventative strategy. Saliva is essential for oral health because it helps to neutralize acids, wash away food debris, and provide calcium and phosphate ions needed for enamel repair. And when someone has reduced saliva flow, whether due to medication, aging, or conditions such as Sjogren's syndrome, their risk for erosion significantly increases. So now I'll move on to management. When it comes to managing dental erosion, identifying the underlying cause is the first and most crucial step because this allows us to tailor the management plan to the individual. So erosion might result from intrinsic acids such as those from gastroesophageal reflux disease, also known as GERD, or frequent vomiting, which is common in eating disorders like bulimia. Or it might be due to extrinsic factors like dietary habits or medications that reduce saliva flow. And as an example, if GERD is contributing to erosion, medical treatment to control acid reflux will be essential. But if it's related to diet, then nutritional counseling might be a part of the approach. The second point is fluoride treatments. Once the cause is addressed, fluoride plays a central role in managing erosion. So topical fluoride helps to strengthen the remaining enamel and promote remineralization. And in more severe cases, high concentration fluoride toothpaste, typically containing about 5,000 parts per million, can be prescribed for daily use. Additionally, in-practice treatments like fluoride varnish or gels can be applied to the teeth during dental visits. These treatments act as a protective barrier and increase the resistance of enamel to further acid attack. And it's also worth mentioning that some products now contain calcium phosphate or other biomimetic agents which can enhance the repair process. And the third point is minimally invasive restorations. So for teeth that have already suffered moderate erosion, you may need to move on to restorative approaches. The good news is that these can be minimally invasive, meaning that we can preserve as much of the original tooth structure as possible. So materials like resin composites or glass ionomer cements are commonly used. Um, when we're talking about glass ionomer cements, these release fluoride over time, which can be beneficial for ongoing protection. And these restorations can rebuild worn areas, restore function, and reduce sensitivity, especially when the dentine has become exposed. And even though erosion is often seen as a slow and gradual process, once enamel loss reaches a certain point, intervention becomes necessary to protect the tooth long term. Thank you.
So, dental erosion can be treated in a number of ways, and the main importance of treating dental erosion is that so that you can protect the underlying dentin. This is to reduce sensitivity and prevent further damage. You also need to restore the shape and function of your teeth because erosion causes obviously your enamel to wear away. This is to rebuild a lost tooth structure and improve your bite and chewing. And then lastly, it's also to improve the appearance of your smile, which is the main aim that dentists want to control. This is to address things like discoloration and other aesthetic concerns. Now, there's a number of ways to treat dental erosion. The main common way to treat it is fluoride treatments. These can help remineralize and strengthen the enamel and stop the erosion from getting worse. It's important to remember that these treatments, they don't reverse tooth erosion because you can't regrow enamel, but there are artificial ways to kind of, look at aesthetic concerns and fix them. And these are basically dental bonding, veneers, and crowns. So dental bonding is where you put a tooth-colored resin material on the affected areas to repair chips, cracks, and like worn edges. It's often less invasive and more conservative, and this is a treatment that you can be used for mild to moderate erosion. For more extensive erosion affecting the front teeth, you can use veneers, which are thin custom-made shells of porcelain or composite resin, which are bonded to the front surfaces of your teeth to improve their appearance and protect the enamel. And then lastly, for more severely eroded teeth, you can put like a crown, which is like a cap that can cover the entire tooth, providing strength, protection, and also restoring its shape and function. Lastly, there's two things that are obviously an overall way to treat dental erosion, which is dietary changes and regular dental checkups. Erosion is mainly caused by acidic foods and beverages, so reducing the amount of obviously acidic foods and beverages you eat and drink can help prevent further erosion. And lastly, regular dental checkups. Obviously, this is really important because dentists are experienced, and maintaining regular visits to the dentist can help monitor any changes that can happen to your teeth, and it's crucial so that they can intervene proactively, give you treatment advice, and then also give you, again, professional advice in general.
Hi everyone, my name is Myra and I'm going to be talking to you about what the long-term impact of dental erosion is. So obviously, to begin with, dental erosion is the progressive loss of the tooth enamel, which is caused by exposure to acids. And these acids are normally like fizzy drinks, soft drinks, and like juices like lemon juice or orange juice. It can result in serious consequences, including hypersensitivity to heat and cold. Now, you can obviously imagine how challenging that is, because wouldn't be able to eat hot or cold things. Like, it's a strain on your life. Exposed dentin, which increases your risk of developing cavities. Nobody really wants to develop a cavity. It's just not a very nice experience. And gradual loss and wear of the teeth. So worn down teeth can't actually perform biting and chewing properly because the teeth will not fit together in a healthy way. So the jaw muscles will then strain, causing damage to the jaw joints, and they could even cause a TMJ disorder. A TMJ disorder is normally categorized by dysfunction of the jaw joints, and it results in kind of like a clicking or a popping sound when you move your jaw up and down. In regards to tooth loss, acid will dissolve the enamel of the tooth over time, which will then expose the dentin underneath. And as you can see in image 2, dentin is like a yellowish brown color. Tooth fillings can also become elevated if the surrounding enamel is worn down by acids, which is shown in picture 3, the top left corner. It kind of shows how the fillings kind of just moved up a bit, and obviously no one really wants to be paying for fillings, because obviously if you're going private, then it will cost more money. It's just something you don't really want to be spending money on, if you can prevent it. Picture 4 shows a 6-year-old boy with dental erosion, and his history actually showed that he had a really high intake of soft drinks and juice. And this kind of caused the melted appearance of the buccal surfaces on the teeth. Also directly below 4A, picture 4B shows that on the front teeth, the pulp is more visible. The erosion process is irreversible and can also impact the appearance of the teeth, making them appear more yellowed or even like translucent or rough, which could result in further self-esteem issues for some people. And enamel is the hardest substance in the human body, yet a little orange juice can take it down. So we should really kind of be mindful of what we're putting in our mouths, and like, not to say that we shouldn't drink soft drinks or orange juice or stuff like that at all, but we should just kind of not drink it carelessly and excessively, and drink it in moderation. But yeah, thank you.
Hi, I'm Mariam, and I will be talking you through some potential interview questions, as I think it's really important for us to practice thinking in this way. So when it comes to in the interview process, you automatically know what to say when they ask you these questions. So there are two types of interview questions. You've got content-based questions and scenario-based questions. Content-based questions are relatively easy to answer. For example, the first question, what are the common causes of dental erosion? We know it's due to low pH and high acidity, and that could be from external factors such as the foods you eat, and intrinsic sources such as vomiting from pregnancy, GERD, and bulimia. And then for the second question, what dietary advice would you give to a patient which shows early signs of dental erosion? That kind of allows you to think in the perspective of a dentist who faces this on a day-to-day basis. So you would probably say something along the lines of limiting intake of acidic foods and drinks and limiting toothbrushing until 30 minutes after you've eaten or drunk those acidic drinks. You would also ask them to drink through a straw rather than drinking through a cup, as that limits exposure to the teeth, and drinking water right after to help neutralize the acid. And also prescribing a fluoride toothpaste if needs be. For the scenario-based questions, you need to think about empathy a lot more and communication, because as a dentist, that is one of your main roles. You have to be able to approach a patient in a way that makes them feel comfortable to continue discussing their issues with you and satisfied with the work you're doing on them. So, for example, the patient with the perfect diet yet shows signs of early dental erosion. You don't know whether that patient genuinely believes that or just feels ashamed to disclose the information about their diet. So you have to ask them like non-judgmental questions and ask them whether they, for example, drink teas and lemon water, because often people think that stuff's good. Well, it's good for your body, but it's not necessarily good for your teeth because it's highly acidic. You also have to explore non-dietary factors such as their medication, because they might take antihistamines which cause xerostomia. And then for the last question, if a 15-year-old girl has dental erosion, and that might be due to an eating disorder because you can see other signs, you would have to ask open-ended questions that lead you to your answer without acting confrontational. For example, you have to ask them if they experience vomiting or acid reflux instead of saying you've got this eating disorder, sort it out. You also want to disclose why you're asking that question. For example, by saying, I've noticed like signs of dental erosion on your teeth, and I assume it's related to acid exposure. And then if you notice that it's quite severe, like a severe eating disorder, you'd have to involve their GP or a mental health professional. Yeah. Thank you.
So the presentation is over. If anyone has any questions, please type them in the chat, and the people can answer it for you. Thank you. If there are no questions, please feel free to leave. But please ensure you have filled out the form. Thank you.
Was that better?
Yeah, it was better. Did you get a recording?
Yeah, I did.
All right, okay. Let's just make sure it comes through. I need to go to the